Hello, everybody. Welcome back to another episode of The Root of the Matter. I am your host, Dr. Rachaele Carver. Today, we are privileged to have Dr. Edgar Vanderhorst with us. Dr. Vanderhorst is a pediatrician, a neonatologist. He's currently at the University of Illinois in Chicago at the Children's Hospital doing a fellowship there. And Dr. Vanderhorst has recently just launched his book, Wellness, Optimizing Yourself, where he blends neuroscience with self-care habits. So I'm very excited for you to tell us a little bit about yourself, with your book, how being a pediatrician, how you come to think about wellness overall. So why don't you tell us a little bit about yourself? Welcome.
Thank you so much for that lovely introduction. Yeah, honestly, for me, I'm from the Dominican Republic. When I embarked on my journey to start to study for the United States medical license examination, I started to understand the connection between neuroscience and wellness. Why? Because when you have to take step one, it's basic science, you have to dig in the physiology, anatomy on the whole body. With that background, the physiology, and then it's really hard because as international medical graduate, you had to outstand your score. You had to do medical missions. You had to have letter of recommendation. So that journey took me to understand something deeper in our body. When I started to understand, when I started to embark on the wellness practice, I said, this resonated with me because I was understanding how one part talk about meditations work in our body, like activating parasympathetic nervous system, how our nutrition balance ourselves, how exercise, how our brain or mindsets work with that part. And when I start here, I did my pediatric residency at New York Mount Sinai, and then I'm currently doing my fellowship of neonatologist, working with the NICU with premature babies. I started to understand that as a pediatrician, I'm not only treating kids or premature babies, I'm impacting family. The role that I play is giving information to the family how they can raise the loved one. But at the same time, most of my patients in the NICU, they don't talk to me. I need to understand the physiology of the body, how the body works. And in that part, understanding how our body works, because when I have premature babies, all the organs are developed, but they are not mature yet. Meaning that I need to understand how the organs work, how the system in their body works, and then I need to improve it. I need to make our environment to make them feel well so they can develop. So in my field, when I talk to parents, there's a lot of information out there, and sometimes I need to make sure that they have the information that they need and they can digest those informations. Because at the same time, you have a lot of information, it's hard for you to understand which one I need to pick, which one it would be feasible. But my point is, if you understand what you are doing and how our body works, it's going to be more feasible and easy to you to help and raise your loved one. So for me, that field in pediatrician was what made me it's touch myself to understand my role here is not only treating kids. That's why I started to do like wellness lectures in my hospital in New York and also here in Chicago because I want to bring an awareness of here in the healthcare system. It's not only treating patients. We have a role in this field, and the role that we make in this field it's something that we should be aware, and at the same time we also it needs to be conscious about what we talk, what we said, and the things that we prescribe to patients and we talk to people.
I think that's wonderful. And the word doctor literally translates to teacher. And so that really is our role. Not the average person is not going to medical school, right? And doing residencies, all these things. They don't necessarily have that background information, but they understand their bodies. They know what it feels like to feel well. And so I always talk to my patients as being a partner. Here, I'm going to bring my expertise. And then again, each person has a unique lifestyle, environment, genetics. And so I love what you're saying, that it's looking at the whole family, right? And it's not just about the physiology and how this little nutrient goes onto that receptor and then all these things happen, right? It's the whole world. Like you he mentioned it's mindset, right? It's there's so many different things. What are the stress levels? And obviously having a child in a NICU is super stressful, right? So those parents, they're so worried about that child being well. And as a doctor, if you can provide the background and here are the things that are going to help you help the child, I think that's invaluable. So I really applaud you for getting into this because, and it's really interesting your journey, right? It wasn't a typical American medical school, right? You actually had to do so much more and you had to see how the whole body works together and understand that concept. So that's wonderful. Your patients are so lucky to have you. And so when you're thinking about as a pediatrician, you're counseling the parents, are you talking to them about nutrition? Maybe give us a few examples of how you are talking to them about wellness and the best way to raise a child who maybe started off with less than ideal conditions at birth.
Perfect. So I normally start with the parents when they get the newborn and they're happy in the journey. I always talk to them like I need to build the trust because in order for patients to listen to the doctor, you have to build that trust. And as a pediatrician, if they don't trust me, they won't follow my advice. So I build that trust because they had to see me like a connector, someone that they can really rely on because they really love this is the loved one that they want the best for them. So I really started to talk about congratulations, the name, and I started to talk about, oh, tell me what your support system, your different factors that you have at home. Why? Because honestly, in the first 2 weeks, we have heard about the postpartum blue. It's because women they shut down different hormones. They worked for estrogen to progesterone. Right now, it's shut down to prolactin that stop all the other hormones. They don't sleep. Why? Because baby you have to feed every 2 to 3 hours. They're deprived of sleep at the same time. And a baby that it's only crying because that's the only way they had to communicate. It's really stressful. So I always say that's okay. That's a new journey you will have, but it's the most amazing at the same time. Why? Because when you breastfeed your baby, you have like oxytocin that helps to connect with your baby. Okay. I always tell them like the poo, the stool will change in color, and that's why the different microbiome. The first one will be black because it's sterile, meaning it doesn't have any bacteria. Later on, when you start to get your breastfeed, it will start to change in color. It's gonna be like a yellow, green color. Don't get scared because a lot of parents get scared. Oh, it's changing color. I'd say that's okay. That's normal. And at the same time, I told him you had to put some creams on the diaper because even though that you change the diaper very frequently, sometimes the stool can irritate the skin. So that's why I told like you have different creams, desitine, and all that stuff. Like if you want to sleep, like when babies sleep, mom needs to sleep. So partners help with that part. I'd say what things baby only breathe by the nose in the first 4 months. So if they have nasal congestion, you will hear like different sounds and you're gonna get scared. That's okay. I gave different tools. We had the bowl suction that help to clean the boobies that they have in the nose. Sometimes they have different tools that they buy on Amazon and they really tell me like, doctor, do you think this one's reliable? I said, well, the brand did not pay me anything, but I can tell you which one is more feasible that you can help to take out the nasal congestion. I say when baby feed, you feed like 20 minutes each breath. After that, you have to board the baby. Why? Because when they swallow, they also swallow air. And if they don't know how to birth, if you don't birth the baby for about like 10 to 15 minutes, he will speed up or vomit because that air needs to go out of the body at the same time. So I started to give some tools, but at the same time, I do it like I can say in a way that they trust me, they feel the trust and they feel like, oh, I can rely. Because most of the time, if you have a pediatrician and you start to tell them like, oh, you cannot do this, you cannot do this, they don't feel that trust and they sometimes they don't want to tell you few things that they do for the baby. And for me, it's detrimental because I want you like feel trust. Tell me anything. Can I give it this to my baby? Because sometimes they say, oh, let me give it this. I won't tell my doctor because he will tell me no. So for me, I'm like, no, no, tell me everything. Be open with me. So that's the way I start to talk to them. But for me, I tell them all this process, like, oh, the school with changing colors because I understand the microbiome. when I say, oh, you need to sleep, because I understand the mental health of the mom, they needs to be healthy in order to take care of the loved one. I always say, oh, if you have anyone that can help you at the same time, because this journey is amazing, but at the same time, I know it's hard. And also at the same time, when the baby goes to sleep, you want the baby to sleep next to you, because we as a pediatrician, we want to decrease sudden infant death syndrome, because sometimes when babies sleep on the stomach, I can say they turn around and they close their nose, and sudden infant death syndrome happens. There's some research, because a lot of parents say, I want to sleep with my baby. Okay. And that's okay. There's some research, you can do it as long as you are not really tired that you can roll over the baby. You can do it. There's only things that you have to be aware of that. And those, I'm really honest with all the parents, and I'm telling all the things that I know and why we do all these things. And they gather and they understand the way that I said. But for me, I start with that part to understand a little bit about the different factors and environment that they have at home, the support system, and how the mom feel at this point. Because I cannot start, okay, now you need to meditate, now you need to do exercise. I go slowly. And then, because they had to see me, we normally say 3 to 5 days after the delivery, then I need to see a 1 month, 2 months, 4 months, and 6 months, because we need to make sure at the baby gaining weight. We need to make sure the milestone. Milestone means how the baby is developing more like motor skill, language cue. That's for us, it's me understanding how the baby is doing. And at those visits, I start to dig in. Oh, tell me how your sleep routine, because your baby will have a sleep routine at around 2 months, and then they jump around at 4 months and they take it out, and then you say, I don't sleep over the night. I say, yeah, and that's regression, because they start to develop few things. The sleep pattern will be disrupted now at this time, but that's okay, you can do it. Then when baby they kids turn, like I can say around 5, 7, I always say, as a parent, you're the role model. They copy everything and they talk everything that you said. So at that part, I start to say, tell me, what do you like to read? Like if you read to a baby at 2 years old, 3 year old, the more you reading, the more words he learns, the better he's going to speak. Those kind of things I start to integrate in my conversation in a different aspect in different visits. So that's how I assess the wellness, and I assess the different factors that can influence how this baby gonna grow and how this baby will develop. And at the same time, I give advice for parents, because sometimes they are honest with me. They say, I'm hard, this is a hard journey, doctor. And I always listen. I'm being empathetic, and I'm telling like, you're doing the best, because I can see the result.
All right. Well, you talked about a lot. I want to kind of go back and talk about a few things. So you mentioned that babies initially are only breathing through their nose. And so this is what I see as one of the main benefits of breastfeeding. Yes, we get the breast milk and all that, but it's also training the child. We know for proper growth and development of the entire face and brain and oral cavity, we need to have good nasal breathing. So when you're breastfeeding, obviously the baby cannot breathe through their mouth, right? It also helps the proper tongue formation to get onto the palate. And it's the tongue that actually makes sure that the palate is wide enough and grows forward enough so that the teeth aren't crowded. Because today, almost every child has crowded teeth. The jaws are deficient. And so that's one of my big reasons why I try to push breastfeeding. Again, not everyone can do it, and that's totally fine. There's no judgment here. But from a dental perspective, breastfeeding is really beneficial for many reasons. And there are better bottles out there, better nipples. Nothing's the same. But that nasal breathing, maybe you can expound on that a little bit about what is the benefit of nasal breathing for brain development or just overall health. Can you talk a little bit about that?
Yeah, okay. Every part of our body, like when you have a newborn, but the physiology, the nervous system does. They have different reflexes. If you put everything in the mouth of the baby, they're gonna suck, because that's a reflex. When they do nasal breathing, it's because that's the only way that the baby will get like air and will have the gas exchange. Okay, because they are at this point, they need to, as you say, develop muscle, like the tongue's a muscle. So that's why with the suck riblets, they need to feed themselves, and at the same time, they need to develop the oral cavity. Okay, they need to give stimulations because that's the body needs. Now, for the brain to develop, the brain needs oxygen. Okay, because they need to create ATP. ATP is adenosine triphosphate. It's the energy that the body uses. Okay, the body, the brain, to stimulate neurons, they need glucose. In order to convert that glucose to ATP, they need oxygen. When you do nasal breathing, it's the part of the physiology for the nasal, like the cavity here, because we have the sinus. Not all the sinus are formed right away. They start to develop later on. The first one that it's developed, we'd say it's the maxillary, then the frontal later on. But it's because that part when those baby are for the first 4 months, they are nasal breathing, they start to develop. So that's how the body should work. And later on in life, you hear people that say, "Oh, I breathe by the mouth," and also use facial structure change when you're a mouth breather. It's because you have changed how it's supposed to be, how your body is supposed to develop in certain things. So when we say, "Oh, baby, it's only nasal breathing," that's how the body works. That's how they need in order to grow different aspects, different features and structures of our body in order to be well. That's the thing that we have in correlations. But there is also different riplets that baby have. Baby have a riplets like when you grab him in the hands, they grab it. So that's they have different cues that they start to, we say, fade it out as the baby start to develop milestone, as we call like in pediatrician to know, oh, this baby reached the milestone the 2 months, because we understand how it needs to work and it's work better for brain development.
So you also mentioned the sudden infant death syndrome controversy and talk about how, well, maybe that's related to having too many vaccines or this and that. As your specialty, have you seen any correlation with nutrition or anything that also maybe predisposed the baby to it versus another?
The only risk factors that we find out, it was in 1994 that they started the campaign ABC for student death infant syndrome. It was to change the position babies sleep. When we talk about like vaccines and nutrition, they haven't had any correlations. Why? Because vaccines that we have developed few vaccines, it's because to prevent some disease that in the past have high prevalence of mortality, and now we are decreasing, make sure that kids can grow like better, and at the same time we have more kids that are surviving. Okay, and with nutrition at that part, like formula feeds versus breastfeed, there's no correlation. It's more about like environmental aspect, how the mental health of the parents.
And have you seen any correlation with? It's interesting in my work. I seemed a long time ago, it was like these children who were coming down with autism. It was interesting. I had one woman tell me that while she was pregnant, she had had 5 rounds of antibiotics. And then the child has autism. Now, I think autism is very complex, and I don't think there's one thing. And again, this is not a blame game, but we're having babies a little bit later. There's more time for us to, we have 80,000 plus chemicals in our environment today, right? There's studies showing babies are being born with 200 plus chemicals in their body already, right? So it's like all these confounding factors. But I'm just wondering if you've done any study or come across studies that talk about maternal nutrition during pregnancy, and then what happens to the baby. Like before we got on here, we talked a little bit about the microbiome, right? So this woman, having had 5 rounds of antibiotics while pregnant, not only decimated her microbiome, but the baby's too. And we know the microbiome is so vital for the immune system. And there is a lot of talk about autism has a lot to do with toxicity and gut issues. So I didn't know in your studies if you came across or have any experience with any of that.
Yeah, that's an interesting question. Honestly, when we talk about like microbiome in the newborn, I would say the first tool is gonna be black meconium. It's because it's sterile. The baby is in amniotic fluid that it had to be sterile. There is no bacteria inside. But in terms of the nutrition of the mom, as when we talk about like when we talk about antibiotics, yeah, we understand that antibiotics kill some microbiomes in the intestine, and microbiome help us to help which type of nutrition we're gonna absorb, and also that will be transferred to the baby. In fact, we don't have any specific study that say, oh, this type of nutrition will help and will prevent to develop any complications later on for these babies. Okay. And when we talk about like autism spectrum disorder, ADHD, those disorder, honestly, as a pediatrician, we don't have the root cause of those disorder. We had different hypotheses and theory. For me, I follow, there's one doctor, Dr. Malillo in New York. He talked about like for ADHD, autism spectrum disorder, it's like a dysfunction between the connection between the right hemisphere with the left hemisphere of the brain. So it's like this organization, he called it, yeah, dysfunction disconnected syndrome, because it's when most of these disorder we identify as a pattern, meaning that it's when those kids start to have the same pattern. And when we recognize those patterns, that's when we do the diagnose. We also have other genetic disorder that can predispose to those disorder at the same time. So for us, it's mainly like nutrition can have an impact on how certain kids will develop or not, like how the microbiome that they have can have a real impact. But for now, we don't have any specific data on that part. We understand that the nutrition that the baby gets, it's meaning for growth at that part. We understand which vitamin is essential that they need. For example, folic acid is really essential in the first trimester to do the brain development. When I called NICU neonatologist, we talk about the perinatology part. It's like when the baby, it's like the fetus grow inside of the mom and how that it's correlation with the mom and the fetus at the same time. What happened the first trimester, second trimester, and third trimester. What they need, the mom needs to do. Why we gave iron, what we gave like folic acids, all these vitamin, because we try to understand the correlation.
Yeah, I don't think there's any consensus. I think any of those, any chronic disease, right? Whether it's autism or diabetes or arthritis, there's always multifactorial because you have to consider the person's diet, their genetics, their lifestyle. I don't ever think you're going to say it's one thing, right? And I think that's really important as a doctor. Whenever I've had associates, I'm always training them. We're not treating teeth. We are treating people, right? Because you could look at a tooth and you could say, well, it needs this, and this, right? And every person, maybe it's something different because you have to consider that the person, their circumstances, what they're comfortable with their body and all that. I'm not trying to put you on the spot or anything. Just curious. There's all these things, especially if you're in the more integrative world. We like to push back a little bit on kind of conventional medicine and say, hey, well, what about this? What about these things? Because I think that's important for discourse. I don't think we ever get any change or progress if we don't question the status quo. And I think right now in medicine, people are frustrated because they feel like the insurance system is a mess, right? We can't, especially where we are, it takes months or years to try to see a doctor. Where we are, you can't even get an internist. It's access to care. It's not just for lower socioeconomic classes, for all of us. I think some people are frustrated. They don't want to go into medicine anymore. Some people are getting burnt out. So their medical careers are shorter than they once was. We're not the old town doctor anymore that would do house calls, because medicine has become very corporate as well. That's why we want to do this kind of podcast, create the awareness about all the different things out here, giving us hope that a young doctor like yourself really understands. I had a patient yesterday who said, she saw that I had a naturopath degree. She said, oh, well, are you taking new patients? I said, well, I'm not. I'm a naturopathic dentist. I'm not an MD. I can't be your primary care doctor. Because she said, we had a great young doctor and she was wonderful. And she really listened and she was interested and she talked about all these different alternatives. She said, but she left. I said, I know, we live in a kind of a rural area. It's hard to keep people around, but it gives me hope that this younger generation is seeing that we need to do this wellness care, right? We need to look at the whole body. So maybe tell us a little bit about your book. What does your book focus on, and how does it combine the neuroscience and self-care?
And honestly, I really like your question, and all the things that you said is really resonate with me, because first of all, if we are the part that we had to start the curiosity to ask questions, to start doing the research. Okay, because if we don't start to ask the questions, how can we gonna evolve as a society? Okay, in order to evolve as a society, we had to start with the curiosity, with the question. And as you told, like in my book, that's what I focus on. And because I want to understand and bring awareness that science is not only one thing, it's the whole body. And the whole body includes mind, body, spirit, something that it's beyond what we teach in medical school, what we learn in medical school. So when you start to understand that part, that there is more about that, you start to have more questions. You want to understand better. And right now it's deep. That's why I like when you say I had some patient, like some patients yesterday that they want doctors that they talk about different things. It's because it's hard to find someone that really had those awareness and really had those conscious to understand that there is different type, and you feel like vulnerable to open and talk about those topics at the same time because you just want the best. Like when I say you only want the best, it's meaning that you just want answer to help others to be in the best version of themselves. So in my book, that's my awareness. It is. It's first I want to change a new perspective, meaning I don't have the whole truth. There is different truth in the book, and like we are all storytellers. But with this, I can just share you the information that I learned. By sharing information, we can, as a storyteller, we can all gather the information. We can together have different things that can help and different tools that can help us to bring the best version of ourselves. However, this seems amazing. We talk about that. But one thing is to have the tools. The other thing is to implement. In a world that is in constant changing, how can I implement tools that help to bring the best version of myself? Okay, because I need to wake up every day morning. I need to work. I need to provide for my family. I need to work. I don't have time to implement tools to talk about those things. However, uh, in my book, after I try to change and make awareness about that, I provide tools, simple tools that I can use in my daily life because I understand how the world is changing. And at the same time, if we don't change as a society, it's gonna take us apart. Okay, so something that we had to think about is in togetherness is our strength. Okay, in my book, I talk about different aspects. I talk about like meditations. When we talk about meditations, people understand meditation is just sitting down and close your eyes and you're meditating. No, meditation is a physiology aspect. It's when you decrease your heart rate, your oxygen consumption, because you had to be calm to understand. When you're calm, you're not your thoughts or what you're the awareness, you're the observer of your life. Because in life we make different choices, but you're not here to make the right choices. You're here to make the choices that it doesn't matter the outcomes, you're gonna take care of yourself. Okay? So I developed a breath technique that I do it in my like when I'm running a code. When I say running a code, a pregnancy can be raw, but out of nowhere the baby can get stuck in the delivery, like coming out, you had shoulder dystocia, and I need to do NRP, neonatal resuscitation program. And I'm under a lot of stress, but at the same time, I need to remind myself and be calm as a leader to tell like each nurses or each other doctor what tasks they need to do. And that's I can not only incorporate like in my field, I can incorporate in my entire life in everything that I do, the way I respond to a stimuli, the way I talk to other people. I'm calm to listen. I'm calm to make the right choices. And when I say right choices, it's meaning there's no right or wrong. It's a choice that I want to do based off what I'm thinking and the knowledge that I know at that moment. I call it the Vanderhorst technique. You inhale for 4 seconds, you hold the breath for 2 seconds, you exhale slowly for 6 seconds, and hold it again for 2 seconds. You do it for 5 times, and you're gonna feel how your heart rate is going to decrease. You can do it either on environment under stress to calm down yourself and understand that part. You can do it every morning laying down in bed with your eye closed. And you can do it when you go at night when you want to go to sleep. That helps you to decrease your heart rate, oxygen consumption, understand when you're calm. Other things that I talk about in my book, it's about mindset. Mindset, it's we can say it's the attitude that we face every situation in our life. But when I talk about mindset, I need to talk about placebo effects. Placebo effect is literally the proof that people can heal solely and believe in expectation. So when you read a positive quote a day, it helps you to remind the perspective that you want to embody in every situation that happens in your life. Because I'd say, yeah, I give you the tools and the information. But are you going to implement when you're under stress? That's and that part is the self-talk. When I say self-talk, I need to talk about love yourself, self-love. Love is a subjective definition. First, you have to define what is love from you because it's not the same. It's different based on your background, your cultural things. And then when I talk about self-love, I need to talk about epigenetics. Epigenetics, it's meaning all the change that happen in your DNA based on your experience. Since you were born till now, no one had the same experience as you. So all the experience change your DNA in a different patterns. So if you want to be fair enough, you can never compare yourself with no one because you're the only one who have your own advantage and disadvantage. But at the same time, nobody give you a script how to be yourself. You're learning. So this is the topics I talk about, like how to see this body as a machine that helps you to cope with stress, giving the healthy diet, how microbiomes work, giving the good sleep, give exercise. Exercise means movement because something that you don't use is gonna be it's going to atrophy. And then I talk about gratitude and uncertainty. With all these aspect and tools that I give you, you understand one perspective that it's about like how our body works, how our temple. This is a life experience. You're here to live life and find out who you are, what you want in life. But in order to dig in this, you have to have the curiosity to understand that there is more. There is no one thing. There is different part of things that we can learn, and we can learn from each other. So something that helped me to get me through my journey and become a pediatrician probably will help you, but some tools might not help you. But that's why we need storyteller. We need people who ask questions. We need people who always had the curiosity. And we also need to be open and be vulnerable to talk with each other. So that's I think that's my purpose, just to share an idea and everyone can bring the best version of themselves and also share that other people can share their idea and the more information we gather together, we can, as I say, in that together it's our strength. We can evolve as a society in a world that is in constant changing. And that's why I like your podcast and I like what we're doing here because here we're sharing ideas, we asking the questions, we doing things that people sometimes they don't do because they just caught up in autopilot in their daily life. But if we don't have those persons who ask the questions, who have the curiosity, who change the perspective, where are we gonna end up?
I had a friend once said, I don't know how you can read so much and you're always trying to learn something. She's like, I'm done. I don't need to learn anything for the rest of my life. And I thought, what? You know, I was just like, I can't understand that concept. But again, the more that you talk about people or the more they listen, some people, when I first started this journey, I went to a chiropractor who did kinesiology and muscle testing, and I was very interested in it. But when she started muscle testing me and telling me, oh, this was off and that was off, and I needed X, Y, and Z, I wasn't there yet. So I disregarded her information. Again, I was curious, but it took another maybe 4 or 5 years before I was like, oh, I really get it. I see the value here. And now I do muscle testing. And then I think back, oh, if I had just listened to her back then, maybe I would, my eczema wouldn't have gone so bad or whatever it was. But so that's what I like to think. I think it's sometimes when you're having conversations with people, the whole last few years created so much division in the world. And I started to get to the point where I have to stop trying to convince people of one thing or another. And I have to respect the fact that we are all on different journeys. And so I had to, because it was making me stressed out and I was frustrated, especially being a mom and trying to make my kids do certain things. I was like, oh, well, that's not really the way to really get anything done. And all I'm doing is creating stress for myself. So I'm not helping anyone. So when I came to that realization, I was like, okay, here's what I know. And all I can do is provide that information. And when somebody wants to hear it and when they're ready to hear it, they will. And so that's why I love the podcast. I don't have to tell anybody what to do, just sharing my experience, because when other people have shared their experience with me and it resonated with me, that's how I was able to go down my health journey and how I was able to make strides and do these great things that I've been able to do. And so that took the stress off me too. Like, people don't have to agree with me. I love what you said, being open, just being open. And I've had to learn how to do that because, again, we all come from different perspectives. So we have to, and this is what I'm trying to teach my kids too, is they're in high school now. So they're like, oh, this person's so mean and they're saying this and that. And I said, think about where they're coming from. I don't like that person because they're so mean. I'm like, well, where do you think that meanness or that bullying might be coming from? If you can have that open-mindedness, one, it's not going to affect you. It's like that stresses you out when that person is being mean to you. But if you can think about that person, maybe they're hurting. And if you can just instead, I said, you don't have to be their best friend, but if you can understand that where they're coming from has really nothing to do with you, then you'll be less stressed and you can get through your day a little bit easier because, again, there's so many stresses. And like you said, that's the mindset, right? And my older daughter, she put on her phone, right, the personal nice affirmation. So every time she looks at her phone, boom, one of those, because she struggles with anxiety and she struggles with confidence. So I love that. I never told her to do it. She just did it one day. And I was like, oh, this is amazing, right? Because the more, you harp on somebody, right, the less, especially children, right, the less they want to do it. But she found that for herself because I've been telling her for a long time, and one time she said to me, she was so brilliant. She was maybe 10 or 11 years old. And I was trying to tell her about, you got to eat better and you got to do this and that, just harping on her. And she said, you know what, Mom, I'm just not ready. And I was like, whoa. I was like, that's very profound. And I was like, okay. I was like, because she sometimes has skin issues. And I said, well, where do skin issues come from? And she said to me, the gut. And I said, okay. I said, so you do know. But she was not ready to make all those changes. And now that she's a few years older, she sent me a text the other day that she said, these are the foods I need to get in. So can you buy this at the grocery store so I can finally get my clear skin? And I was like, all right. So that my point is getting this information out there, right? And these little snippets over time. They say people have to hear something like 7 times, right, before it kind of sinks in. So that's the deal, right? We just provide the support and the information. And when people are ready and they want to hear it, and they will. And so I think that's the value in being a doctor is supporting your patient where they're at. You're supplying the medical expertise, but you're also supporting them in their own journey. And it's very hard, especially as a dentist, right? Nobody wants to go to the dentist, right? Everybody. So sometimes you have patients who are angry men, and it can be, that's why dentistry can be really stressful, right? Because you already have energy coming at you. And so many times people say, it's not you. And of course, if you're a more sensitive, empathetic patient, it can be challenging, right? To be in a medical profession where people are in pain and this and that, and you have to set back and say, it's not about me. I didn't cause the cavity. I didn't cause this problem. I'm just here to help. And when you frame that way, you can be a better doctor and a better advocate for that person. But sometimes it can be challenging and it takes many years to get to that point. But again, the more that we show that support, like you said, trust is absolutely vital. And we've lost a little bit of that trust, especially over the last few years. So recultivating that trust and that support is absolutely vital in the work that we do.
And something that I really like about the story that you told me about your daughter, one thing, sometimes we need external things to remind ourselves the perspective. When she have on the screen the positive things, the quote, that help us. Because sometimes we understand the tools, we have the informations, but in order to implement, we need something that remind us some external things. So when we see something externally, it's remind us the things. And other thing that I really resonate is, as a doctor, for me, it's not only to have the knowledge. It's in a way that I need to understand that knowledge, that I can simplify and communicate that knowledge in a way that people can digest and understand that. Because for me, it's not bombarding you with a lot of information that, oh yeah, he's a doctor, he understands those things. But I don't understand. I don't know what he say. I just know that he say those things and he understand the body. So my way is Yeah, I'm a doctor. I understand those terminology. They don't have to know all these terms. But for me, it's to simplify and give it in a way that it can resonate and they can understand that information in a better way that they can implement that part. Because sometimes that barrier that we can have as a doctor and patients is that the doctor tell me one thing and he's right, but I don't understand quite the thing that he's telling me. I need to understand a different way. Why? Because I don't know all those medical jargons. And sometimes we had the misconception, it's my mistake, we throw out the medical jargons that we know, but because we think, oh yeah, they will understand. No, let's simplify the things that we say. Let's simplify the information. Understand that information in a deeper way that it's gonna be easy and accessible for others to understand and communicate well that part. So I think that's something that I'm working on it too, because as a doctor, sometimes we try like, yeah, I put in that easier way the information, but sometimes we throw out medical jargons without realizing things because we got used to it. So that thing that I want to change, like also in my book, I talk about medical things, but I put it in a way that people can understand and it's easy to digest. To put it in a simple way, simple format, and I think that's something that we try because that's also it's how to build trust. Because how can you build trust with someone that you don't understand what he's saying, even though that he have all the recognitions, you know that he's smart, but you don't understand him. So that's why for me it's something that the trust that you build also goes with the communication that you have. Develop those qualities, as you say, be empathetic, okay, be vulnerable, but at the same time have effective communication with the patient, have effective communication with someone else that you're talking to.
Absolutely. That's communication is the cornerstone to any relationship, and especially with the doctor patient. So very, very vital. Well, we're about wrapping up time here, Edgar. Is there anything else you would like to leave us with? And tell us again the title of your book and how we can get a copy of it.
Perfect. Yeah, for me, I would like you can find the book on Amazon. The title of my book is Wellness Optimizing Yourself. You can see the hardcover, paperback, audiobook. I have the ebook on Amazon. You can get it. Also, you can find me in different social media on Instagram, Edgar Reynolds Vanderhorst, Dr. Vanderhorst, and also I'm in LinkedIn. And one thing that I really like to say, there is one of my favorite quote. It's by Carl Jung that say, "The world will ask you who you are, and if you don't know who you are, the world will tell you." So be curious, find yourself, understand there are deeper informations. Have the curiosity to change your perspective and know there is more than what you think there are.
Fantastic. Well, thank you for this conversation and coming early morning to share with everyone here. So I wish you the best, and I'm excited again to see a young doctor who really understands the full body care. So again, I wish you the best of luck. Thank you so much for sharing your expertise with us. Thank you, everybody, for listening. I hope you have a wonderful day. Hello, I'm Dr. Rachaele Carver, a board-certified naturopathic biologic dentist and a certified health coach. Did you know that over 80% of the U.S. population has some form of gum disease? Many of us don't even know that we have this source of chronic infection and inflammation in our mouth that's been linked to serious consequences like heart disease, diabetes, stroke, dementia, colon cancer, kidney disease, even pregnancy complications. Would you like to learn how to reverse and prevent these chronic debilitating conditions without spending a lot of time and money at the dentist? Join me for my 6-week course where I will teach you the root cause of disease. You'll learn how to be your own best doctor. Are you ready to get started? Let's go.